Now joining us to talk about your health is Dr. Shana Ntiri. She is medical director of the Baltimore City Cancer Program at the University of Maryland Greenebaum Comprehensive Cancer Center and an associate professor of medicine at the University of Maryland School of Medicine. Doctor, thank you so much for joining us again.
Thank you so much for having me.
It is Cancer Prevention Awareness Month. So let's start there. What do you want people to be aware of when it comes to cancer prevention? Because people may think, it's mostly about fate.
That's a good point. I think that's what we want people to know, that it is not mostly about fate, that certainly cancer can be prevented. It can be prevented in different ways. It can be prevented in terms of modifying your lifestyle and the things that you do to stay healthy. It can be prevented in terms of doing cancer screening and other things, and coordinating with your doctor. So I think that's the message that we want to get out to folks.
There are a number of cancers where the incidence is on the rise. Why would that be? And is it possible that it's connected to increased screenings and early detection, which is a good thing, but maybe changes the numbers?
Sure, that's a good, important question. I think there are cancers that are going up. Right now, we don't think that the number of cancers that are going up are a reflection of increased screenings. But an important thing to point out, really, it's just a matter of multiple things, including the fact that we're still feeling the tail end of COVID when people were not completing cancer screenings. And also, although we have this knowledge, people really are not fully taking advantage of it. Our population in general is getting older, right? So people are living longer, which is a good thing, but getting older is a major risk factor for a number of cancers, and there are just more people in our country as well. So there are a myriad of reasons that we're seeing an increase in cancer screening or cancers.
And, nobody wants to get bad news,
Sure.
but tell us what you've seen in your medical career about the advantages of getting an early diagnosis of something.
Yeah, I have seen people who survive their cancers, which I think it's an enjoyable walk to have with a patient after getting such a serious diagnosis, for people to realize that there is absolutely hope, there is absolutely life after a diagnosis of cancer. And that's why cancer screening is so important, right? If we get this information, the earlier we get it, there's a phrase, early detection saves lives, the better the outcomes are going to be. And I can think of a number of patients right now who've been diagnosed with breast cancer, with colorectal cancer, that when they got the diagnosis, for good reasons, were quite frightened, but are now cancer survivors. I work with a breast cancer survivor group. We've got women in that group who've been diagnosed with cancer 30 years ago. So they're 30 plus year survivors. So absolutely, I think screening is essential to people living quality lives after a diagnosis of cancer.
I was going to ask what the screenings you want people to focus on would be, but I imagine breast and colorectal cancers are at the top of that list or close to it.
Sure. There are 5 cancers that we can screen with. So breast is certainly at the top of that list for women. And we screen via mammogram. There's also PAP and HPV screening that we do for women to look for cervical cancer. Then we talked about colorectal cancer, which affects both men and women. We can screen using a colonoscopy or a stool-based test. And then there's lung cancer, which also affects both men and women. We use what's called a low-dose CAT scan or low-dose CT screen for individuals who have a history of smoking. And then there's also prostate cancer screening using the PSA, which affects men only, and that's a blood test. So lots of different ways to screen, different criteria for when and why people should screen. And that's really a conversation to have with your primary care doctor or other healthcare provider in order to determine when you should start to screen.
It's too bad there's not a simple answer to that you can't just tell everybody you don't have to worry about any of this until you're 50 and then come
Right.
see us.
Yeah.
Because all the cancers are different, everybody's history is different, and your physician may have different recommendations.
Yeah, absolutely. There are guidelines though that are age-based, and I think, I would push as a primary care doctor, as a family physician, that's why you want to have a family physician or a primary care doctor, that those are conversations that you have over time. And the more you have those conversations, the better understanding you have in terms of when and why you would want to screen. So it's no surprise.
February, of course, is also Black History Month, and we want to focus a bit on the disparities that we continue to see in the diagnosis and the treatment and unfortunately the outcomes of
Yeah.
many cancers. Tell us what you're doing to fight that.
Sure. I like that question as well. It's an important one. There are significant inequities in terms of outcomes, specifically for African Americans and other racial and ethnic groups. But when you look at overall outcomes in terms of survivorship for Black men, the death rates are up to 20% higher when in comparison to other groups. And then looking for African American women, you'll see similar things, especially when looking at breast cancer. One of the things that I do, I have the privilege of working with the Baltimore City Cancer Program. I serve as the medical director for that program, and that program really targets its services at individuals who are underserved, who do not have insurance and don't have regular access to healthcare, which is a key component in terms of disparities that we see in groups. Really having access to quality care that is delivered without bias, that helps to break down some of the walls that there are around mistrust, helps people to get access to care, and definitely improves outcomes. In that program, we're going into 23 years as of August this year and have done over 38,000 cancer screenings for individuals in Baltimore.
You mentioned mistrust
Yeah,
and number of reasons for that,
sure.
but how do you address it? How do you try to break through any walls, any barriers that might be out there?
Good question. I mean, I think mistrust is based on a number of things. As physicians, we are trained on something called implicit bias, which is really the perspectives that you bring into the healthcare room, how your lived experience shapes how you see the world and how that may impact your patients. And I think trying to acknowledge and understand what an individual's biases are as a physician is key to that. And also being open and willing to allow the conversation around healthcare with the patient to be one that is shared, to be one where you're open and honest and where patients are able to ask questions as much as I'm able to ask questions and we give honest answers where people can develop trust over time. I think that's another important thing, not expecting that when a person walks in the door and meets me for the first time, that I'll have 100% of their trust. That's not a reasonable expectation. And as a family physician, we have the benefit of longevity of relationships with patients and being able to develop those relationships over time.
In our remaining time, let's focus in on the idea of cancer prevention. What
Sure.
sort of thing can people do to lower their risk?
Great question. I think I spoke to a colleague who said we can still say Happy New Year if we haven't seen a person through June. And there are a lot of folks who are still working on their New Year's resolution. So a lot of the things that we would talk about in terms of cancer prevention are things that may be on that list: increasing physical activity, quitting smoking, decreasing weight, eating a healthier diet, decreasing the amount of alcohol consumption, all of those types of things. And then, of course, scheduling your cancer screenings and getting those done. And if there are any questions or concerns, making sure that you follow up with recommended follow-up testing.
I read in your bio that you divide your time between direct patient care, teaching, community-based cancer control, and research. I
Yeah.
don't know how you have time for research, but tell us a little about your research work.
Oh, yeah. So I do a lot of work that is focused on inequities in terms of cancer outcomes. So interested in interventions that can be done in the primary care setting to help around cancer. So thinking about things like using text messages to remind individuals to get their mammograms done, programming or communication for parents to increase HPV vaccination, which is associated with a number of cancers, so those types of things. And then also looking at things such as the impact of finances around cancer treatment and how that might change a person's course in terms of what they want to do with cancer care.
Very good. Dr. Shana Ntiri with the Baltimore City Cancer Program and the Greenebaum Comprehensive Cancer Center. Doctor, we appreciate your time. Thank you very much.
Thanks so much for having me.